Hi guys, welcome back to my page. Today we'll be discussing about breast malignancy. Why we'll be discussing about breast malignancy is because this is the month of October, and October is known as the World Cancer Month. Both every form of cancer, both cervical cancer, breast cancer, colorectal cancer, prostate cancer, but we are going to discuss breast malignancy, breast cancer. Breast cancer occurs mostly in women. However, you can find up to 1% occurring in men. So if you have about 100 people with breast cancer, 100 women or 100 people with breast cancer, 99 will be women, while 1 will be a man. So that is why intermittently is expedient that you examine your breast. And for the purpose of breast self-examination, I'll be teaching us how to do it on this video. So that's why I'm making this video. This video is all about how to do breast self-examination. So what do you do? When you want to do your breast self-examination, you stand in front of your mirror, you stand, remove your clothes, the top, remove your shirt. Be in front of your mirror, remove everything, remove your bra, and you stand in front of your mirror. So through the mirror, you look at your breast. You are expected, bring your hand down, look at your breast. Check, what are you checking? Check the breast size. Normally, the two breasts are not supposed to be the same size. However, the difference is insignificant. When one is bigger than the other and it's not usually the way it used to be, you should raise an alarm. So you check the size of the breast, and there you go. You check your breast skin, the skin of your breast. Is there any place that has dimple? Is there any place, you know the back of orange? If any place is looking dotted like the back of orange, you call it peri-orange, something is wrong. Check if there's any place that looks like there's a mass there. You have to note those places. Then check your nipple. Are the nipples retracted inside? Normally the nipple should be everted, but when they retract inside, it may be a problem. So when you are finished, check the skin and the way it looks. Is anyone shining more than the other? Note these things, because it's usually better you know the normal from the abnormal. So when you do this regularly, it will give you a hint of what the normal is like and what the abnormal will look like. So when you stand this way, you look at these things that I've mentioned. Then you raise your hand. Raise your two hands, put them at your back, at the back of your head. Check the breast again. If you put your hand like this, it will help you to note if there are anything below the ones you are not seeing. And for people that have already had pendulous breast, you also note, and it will help lift the breast for you. So note the same thing I mentioned before. Note the size, note the nipple, note the skin, note if there's any shining area more than the other. When you finish doing this, put it at your waist. This will put pressure, stroke tension on the breast, so that if there's any other thing that is not shown while your breast, when your hands were down, it will show at this moment. So you put this way, you check this side, you check this side, then check your armpit. Remember, you're not wearing clothes to do that. Check your armpit. So when you have done that, there's nothing different from the normal. Now you go on to palpate. You use your right hand to palpate for the left breast. You use your left hand to palpate for the right hand. If your breasts are already pendulous, you can use the left hand to support the breast. So you do this. You use this part of your fingers, this part, not the tip, the paw, this area. You use it this way. This is the place you use. Use it to go around that breast. So you hold your breast. You go from one part, you divide it into 4 quadrants. You go this way, go this way, go this way, then go this way. You are back to where you started. When you do this and you do not feel any nodularity, you do not feel any lump, then come to the middle. That is where your nipple is. Press it. Make sure there is no lump seen. When you have done this, you go back, check to your axilla, to your armpit. Make sure there is no mass. You are not feeling any lump. When you are done with this one, then do the same thing here. Use this one to hold, then go. Palpate, palpate. Do it like this, do it like this. Get back to where you started. Then check your nipple. If you do not feel any lump, now you use both hands to press from the base to the nipple. that is not breastfeeding is not supposed to have any breast milk coming out. Any woman not breastfeeding is not supposed to have breast milk discharge. So when you press and there is breast milk discharge, you should seek medical attention. You are not supposed to have blood discharge from your nipple. It's a sign that something is wrong. Not supposed to have any greenish discharge from your breast. It's a sign that something is wrong. So when you do this on this side, do it on this side too. Press. Then when you have done that, make sure you check both axilla, because your axillary tail of breast, the tail of your breast is in the axilla. So when you have finished doing this and there is nothing, it's okay for that month. You are expected to do a monthly breast examination as a woman. Let it not be only your husband or your boyfriend that is finding lump on your breast. Then when are you supposed to do it? It's expected that by the 10th day of your menstrual cycle. Let's assume that you started seeing your periods today. Today is the first day. So count from today to the 10th day. You can do your breast self-examination. If you have stopped seeing your period, it's expected that you choose any day of the month. Maybe assuming if you choose 5th, you'll be doing it every 5th of the month. So this is how to do breast self-examination. No breast is supposed to have any lump. If you see any lump in your breast, whether painful or not, you are expected to visit the hospital for it to be removed. No lump should remain in the breast. It must be removed. Let us try as much as possible to do this to stop breast cancer. Breast self-examination is one of the ways to prevent death from breast cancer, to detect breast cancer early, and for it to be managed early. If it's detected early, it will help the person to survive. So thank you guys for watching to this point. My name is Dr. Nkiruka Bridget at OBGYN Talks with Dr. Adazion. I discuss everything about women's health, children's health, and sometimes men's health on my page. Please subscribe. Follow me on YouTube page, TikTok, and on Instagram with the same name, OBGYN Talks with Dr. Adazion. See you next time for another enriching video. Thank you guys.